name is Tanisha. I'm the Clinical Nurse Coordinator for Surgical Services here at Ogden Regional, and I want to thank you for choosing us to help be a part of your surgical experience. Today we're going to talk about some of the things that you can expect while here at Ogden Regional. You will be greeted by one of our patient care techs in the waiting room. You will be giving them some paperwork. That might be your registration packet that you received up front. It could be your health history as well as a medication list filled out. That will help to expedite your admission process. After you've been checked in, you will be brought back to a patient room by one of our registered nurses. First stop will be at the scale. That's where everybody loves to stop. After we get your height and weight, we'll bring you back to a patient room. We will review that information that you filled out on your health history as well as those medications, making sure that that is all correct. We will have the opportunity to possibly do some lab work, maybe even an EKG, so that we can make sure we have all the information we need to proceed with a safe surgery. As part of our process, we will have you meet many members of your care team. That will include our anesthesiologists. They too will come in and go over your health information, review those medications, and make sure that all of that information is correct. They will discuss with you your plan of care, answering any questions that you might have. After you've spoken with them, we'll have you sign a consent giving permission to proceed with anesthesia. You'll also meet the nurse from the operating room. He or she will come in and go over the same information you've covered with some of your other providers, just a more abbreviated form. We want to make sure we have the right patient, we're doing the right procedure on the correct site, so please get used to answering those questions. You'll also have the time to speak with your surgeon one last time before you go back to the operating room. He or she too will come in and visit with you, answer all those last minute questions, concerns. They may also take a marking pen and mark that surgical site to make sure, once again, right patient, right procedure, correct site. When it's time to head back to the operating room, you will part ways with your contact person who came with you today. We can give hugs, kisses, high fives, I love you, fist bumps, whatever way you want to send off your loved one to say, I'll see you shortly. You will proceed back to the operating room, and then when surgery is all done, our surgeon will come out and speak with your contact person to let them know how you did. At that point, you will be transitioning either to our recovery room or over to our phase 2 recovery. While in the recovery room, plan on being there about 45 minutes to an hour. As you're waking up, we will continue to monitor heart and lungs. We will also look for nausea and pain and make sure that you're waking up as comfortable as possible. Once you're finished in the recovery room, you will transition either to phase 2 recovery in same-day surgery or to the appropriate floor outside of this area in the hospital. Either way, we will let your contact person know where you're going to end up so that you can be reunited. If you are being discharged from same-day surgery phase 2, you will be brought back to a room and rejoined with your contact person. We'll get you a drink, a little something to eat. We'll continue to monitor your vital signs, making sure you're waking up okay, controlling that pain and making sure that nausea is minimal. When it's time to go, we are going to discuss a lot of important information. This includes instructions for care afterwards, how to manage pain, nausea, watching for infection. You will get specific information related to your surgery, as well as some generalized information for all patients recovering from surgery and anesthesia. This information will be included in written form as well. You will go home with a folder from the hospital that you can refer back to this information if you have any questions or concerns. You will also go home with a small thank you gift as a token of our appreciation for you choosing Ogden Regional for your surgical needs. On the back of this thank you gift is a QR code. That QR code is very valuable. We'd like to hear compliments, concerns, questions, celebrations about your experience here at Ogden Regional. Please feel free to use that so that we can improve our care and also hear about those successes that we've had. Once again, thank you for choosing Ogden Regional for your surgical needs. Thank you.